Good afternoon. My name is Dr. Robert Kimmel, and I'm going to be discussing the topic of neck rejuvenation. Over the years, many of my patients have expressed some frustration and some dissatisfaction with the contour in their neck, specifically the blunted angle between their chin and their neck, the so-called cervical-mental angle. They express it in various ways. Some refer to it as a turkey neck or a waddle. And on occasion, they even complain that certain shirts can be difficult to button at the top button of their collar, or that the tissue overrides their collar. They've even expressed dissatisfaction with the way they look in certain photographs. But whatever their motivation, what I inform my patients is that there's a variety of different techniques that are now available, both surgical and non-surgical, which I can commonly employ to improve their neck appearance. My approach to neck rejuvenation always begins with a complete history and a focused physical examination during a free cosmetic consultation. During that consultation, what I'm looking to establish is the relative amounts and distribution of the three cardinal layers of tissue in the neck, which include the skin, the fat, and the muscle. Once I've had the opportunity to assess that, then we can arrive at the exact diagnosis and therefore the exact treatment that's going to maximally benefit the patient by addressing those specific abnormal layers. Now, 30 years ago, the discussion would have been relatively brief because at that point, surgery was the only available type of treatment. Nowadays, we have both surgical and non-surgical options. So the discussion about the options then becomes a little more lengthy and complicated. Let me explain the options. So beginning with the anatomically most superficial layer of the neck, which is the skin, the traditional approach and gold standard for establishing optimal tension is now, and always has been, a neck lift. And briefly, a neck lift involves incisions that are placed remotely behind each ear. Through those incisions, we are basically releasing the neck skin from its underlying attachments throughout the neck. We're then able to advance that tissue back into the region behind each ear and remove the excess tissue remotely behind each ear where it's relatively inconspicuous. Now, some patients may not care to pursue that magnitude of surgery and its associated 2-week downtime, or for whatever reason may not be candidates. For those patients, we do have an appropriate non-surgical options. I tend to use radiofrequency energy, known as thermage, in order to non-surgically tighten the skin. This is a procedure which is done in an office setting, either under no anesthesia or in some cases some oral sedation, but literally requires no downtime after the procedure is completed. Proceeding then to the next deeper layer in the neck, that's the fatty tissue layer. The surgical approach to this area involves either directly excising the fat through an incision beneath the chin or using liposuction. When the direct excision approach is taken, that can commonly be combined with a neck lift. If we're using liposuction as a standalone option, then it involves several very small 2 to 3 millimeter incision, one of which is spaced beneath the chin and the other two of which are behind the earlobes on either sides. So for patients that may not require an excision or not be motivated to get some type of surgical excision, there is a non-surgical option. This involves the use of a fat dissolving enzyme known as deoxycholic acid, or Kybella. Kybella is performed as an office-based procedure. I perform it under local anesthesia to optimize the comfort of my patients in the office setting, requiring approximately 20 minutes of time. Typically, it's 2 treatments, spaced at 6-week intervals. And afterwards, I encourage my patients to use a lightweight nylon compression garment when they're at home or in the evenings in order to facilitate with the skin redraping once the fat has been dissolved. The third and deepest layer of tissue in the neck is the muscle layer, called the platysma muscle. The surgical treatment of this muscle layer involves tightening of the muscle, or what's called a platysmal plication. In some cases, the muscle is brought together end to end. In other cases, it's overlapped so that it creates a tightening of this deeper layer. For patients that may not be eligible for this type of procedure, there is a surgical, non-surgical option of using the injectable botulinum toxin or Botox, which then relaxes the muscles and tends to minimize any band formation that can sometimes bowstring across the angle between the chin and the neck and kind of obscure the normal crispness of that tissue angle. Keep in mind that any of these procedures can be performed as either standalone procedures or in combination with one another to create a multi-layer improvement in situations where patients require that multiple layers of their neck tissue be addressed. So for those of you who may be dissatisfied with your neck appearance or maybe seeking a more crisp, rejuvenated neck angle, I encourage you to contact our office. I hope this has been helpful. We can be contacted at phone number 570-622-2900 or online at keystonecosmetic.com. Please call and schedule your free cosmetic consultation in either our Pottsville or Hazleton office, and we can work out your individual treatment plan that can be precisely customized to your situation. Until next time, this is Dr. Robert Kimmel saying I'm looking forward to meeting you and helping you to become what you envision. Thank you.